Hello, my name is Ivy. I'm a fourth-year social work student at Toronto Metropolitan University. I'm currently completing my placement with the Organization for a Safer Space. Today, I'll be talking about dissociative disorder. In this video, we'll first look at what dissociative disorder is. We'll then look at the risk factors and causes, symptoms, effects, treatment, and lastly, we'll look at some coping strategies. Dissociative disorders are mental health conditions characterized by feelings of detachment from one's thoughts, consciousness, identity, or memory. There are three types of dissociative disorders. Dissociative identity disorder is a condition in which people have more than one separate identity that controls their behavior. Dissociative amnesia is a condition in which people cannot remember most or specific important information regarding their lives and/or identity. Depersonalization derealization disorder is a condition involving the feeling of disconnect from one's thoughts, feelings, and body and/or environment. It is estimated that 2% of the United States population experience dissociative disorders, affecting more women than men. Risk factors and causes. Dissociative disorders typically develop when people deal with traumatic situations, usually experienced in childhood, as people may mentally remove themselves from the situation to cope. This method of coping may lead to separating oneself from reality and the removal of memories. Traumatic situations can include physical, sexual, or emotional abuse, natural disasters, accidents, and experiencing crime. Dissociation can co-occur with conditions such as depression, schizophrenia, obsessive-compulsive disorder, post-traumatic stress disorder, phobias, and epilepsy. Symptoms. The symptoms for dissociative disorders include the feeling of disconnect from oneself and one's surroundings, feeling like one is in a dream in which things are not real, loss of memory regarding time periods, events, and people, including information about oneself, feeling uncertainty about who one is as a person, possessing multiple separate identities with distinct characteristics, feeling little to no physical pain, emotional numbness, depression, anxiety, and suicidal ideation. Effects. If left untreated, dissociative disorders can significantly impede one's life. It can lead to self-harm and suicide, which are common in people with this disorder. Approximately 70% of people with dissociative identity disorder attempt suicide. Other complications include alcohol use disorder, drug use disorder, depression disorder, anxiety disorder, personality disorder, post-traumatic stress disorder, sleep disorder, interpersonal issues, occupational issues. Treatment. The most common treatment for dissociative disorders includes psychotherapy. A type of psychotherapy is cognitive behavioral therapy, which helps people understand and change their thoughts, feelings, and behaviors, learn techniques to manage stress, and reduce anxiety and depression that can co-occur with this disorder. Another type of psychotherapy is dialectical behavior therapy, which is aimed at people who experience extreme emotions. This type of therapy can help people accept who they are and learn skills to manage their emotions. A doctor may prescribe medication as well, which can include antidepressant medication to treat co-occurring conditions such as depression or anxiety. Coping strategies. To decrease dissociation and improve self-awareness, people with dissociative disorders can practice some of the following strategies. Regularly use their five senses by naming what they see, feel, hear, smell, and taste. breathe slowly and focus on one's breath to remain present in the moment, or breathe slowly while counting. Write in a journal daily by writing about their day and any dissociations they experience, along with their co-occurring thoughts and feelings. Wearing a watch to keep track of time. Being in regular contact with family and friends. Other activities to manage one's well-being can also be beneficial, including getting adequate sleep, eating healthy, and exercising regularly. If you have any of the symptoms described in this video, it is important to seek help. Feel free to check out the organization For a Safer Space at forasaferspace.org, where you can have access to accessible, affordable, and affirming mental health care with licensed mental health professionals. Thank you for watching and have a great day.